Hi everyone and welcome back to the channel. Today we are going to be looking at this COVID-19 epidemic, and we're going to be looking at the good, the bad and the ugly of it. And we're going to try to clear up what's going on the news this week with this virus and epidemic. And I'm telling you, it may just be worse than you think. So let's get right into it. So for those of you still unaware of what COVID-19 stands for or means, here's what it is. The CO in COVID stands for corona. The VI is for virus. The D is for disease. The 19th refers to the year 2019 when it was created. And again, that is how we identify the coronavirus, COVID-19. And so that brings us all up to date on what's going on with the name. And again, you know that it originated in Wuhan, China. So a lot of people now call it the Chinese virus. So now, to bring you up to date as of yesterday, what happens is the state's restriction during the coronavirus outbreak. You could see the light grayed out blocks and states not announced. They're absolutely doing nothing right now with the virus. No orders in place right now. The blue is non-essential businesses are closed in these states. So states like Maryland, Virginia, Pennsylvania, DC, this tri-state area, Connecticut, Kentucky, Nevada, all of these states right now have non-essential businesses are closed. And then the orange states, or that yellowish color, is stay home. Non-essential businesses are closed, but there's also a stay home, meaning residents are advised to stay indoors unless it's necessarily to travel to the pharmacy or the supermarket or in some type of emergency situation. So that's what's going on with those states right now. Coronavirus disease, what is considered essential businesses? Throughout the world, everyone considers in that state, in that city, in that country, what is considered essential business. In our area here, in the Maryland area, most of what is considered essential, chemical sector, people that work in commercial facilities, critical manufacturing, like manufacturing of respirators and ventilators and stuff like that. Defense industrial base. We do have the Army base and stuff here as well in Maryland. We have emergency services, financial services like banking, insurance and stuff can still operate. Food and agriculture, supermarkets, groceries, food stores, anyone with a restaurant that for takeout only in the state is active. Government facilities, not all, but some. Government facilities, and then they have the healthcare facilities, informational technology, transportation, obviously buses, trains, public transport, and waterways is also considered in this state essential businesses. Thing to note with essential businesses, notice that anyone that gets paid a huge income and a huge salary, movie actors, sports teams and players, they're not anywhere on this list, and these people make massive amount of money. However, these are the everyday workers that get paid little to no money at all, in most cases when you compare to other incomes. Yet these are the emergency and essential workers that is needed to operate your life and the economy of the state and the country on a day-to-day basis. So if you get a chance or you know someone in one of these services, reach out and give them a thumbs up. Let them know that they've been doing a fantastic job, and appreciate these workers because they're the ones that are actually running the country right now, while some of you are actually confined to your homes and rendered redundant, redundant, and I would say absolutely useless when it comes to saving the lives of so many people. So again, I say useless, not in a bad way, but when it comes to essential needs, you are really absolutely useless in most cases. So all we could do is rely on these people to risk their lives to go to work without mask in most cases, without the equipment they need on a day-to-day basis, to serve the community and to make sure that everyone is not in panic mode. Because without these people, I have no idea what any of you are going to be doing. Transportation, gas, it's great that we have gas prices down. We have the lowest gas prices, but there's nowhere to go. So that's completely useless. The airplane travel is absolutely at the lowest fares right now and rates, but there's nowhere to fly to. So a lot of things are good in the economy, but it's absolutely useless to any one of us right now. So with that said, let's move right along. Here's what was interesting, and I saw in some news feeds this week. And so tomorrow is the 26th, which was obviously yesterday, and the year is 2020. So check it out, Isaiah 26:20. For those of you that enjoy the Bible, reading gospel stuff like that, this you would find very interesting. I thought it was interesting. Isaiah 26:20, because of the date. Go, my people, enter your rooms and shut the doors behind you. Hide yourselves for a little while until his wrath has passed by. Now, that is pretty interesting. That made for a good read. So you have nothing else to do. Some of you bored at home. I would suggest maybe it's time to pick up the Bible. And most of the information is in there listed for you to read on a daily basis. Now, this was really funny, I thought. And some of you will get it. Some of you would have no idea what we're talking about. But villagers in Punjab still wondering who the hell is social distancing. And a lot of you folks will get that joke. I thought that was pretty interesting this week. But more on a more serious note, this is here in Maryland as of this morning. Cases by age, range, and gender. Here you will see that this virus is absolutely affecting every age group. It is not the older people like we thought, 80, 60 years and up, 70 and up. Yes, they do get hit. But I want you to check out the age group of 30 to 39 years old. And you would see that they have 136 cases, 40 to 49 in the state, ages, 161 cases. Male, female, 382 female, 392 male. So as you can see, all ages, even between 0 to 9 years old, 4 cases. So from birth all the way up to 80 plus, this thing is affecting the entire community. So that was an interesting thing to take note of this week as well. And then moving right around, coronavirus or something else. So it's allergy season here in most of the states that where people suffer from allergies and stuff. So it is very important that you know what is allergies, what is corona, so you don't virus, so that you don't go and get really stressed out and worried and go into panic mode. Now, cold or allergies, itchy eyes, stuffy nose, sneezing, flu or corona, fever, fatigue, body aches, cough, worsening symptoms. And then the coronavirus itself would be pretty much shortness of breath, history of travel, or exposure to someone that is exposed. That is why it is very important when someone is affected and quarantined or told to be quarantined, anyone that they were in contact with recently should be immediately alerted so that they would know to check themselves as well and quarantine themselves before we go on affecting so many more people. There's so many people, governments, townships, governors, prime ministers of certain countries that are not actually informing the people fast enough so that they could check to see that, hey, I know this person, I wasn't associated with this person, I need to check myself, quarantine myself, because we don't know who's walking around with this virus. A lot of us are walking around the virus on a daily basis, and guess what? We don't even know that we are infected, and we pretty much carriers of the disease or the virus, and we are spreading it without any knowledge of what's going on. So as soon as someone you know is infected with the virus, go and alert your friends, family members, check in with your doctors, see what it is they need to say or do, and then they would advise you whether you need to go into the hospital emergency room or what else is the follow-up on that. So that is a quick note on that. Now, Spanish biological researcher, you give footballers 1 million euros a month and a biological researcher 1,800 euros. Now, that's $1 million to 1,800. It's quite a vast difference that these ball players get. And you're looking to for treatment now, go to Cristiano Ronaldo or Messi or Messi, and they will find you a cure. It's just a little meme here to check reality on how much we pay people that are actually where our lives depend on it, our very existence depend on it. These people should be paid way more money than someone that is just entertaining us. Does that make sense? Anyway, let's move right along. It is interesting, this meme that I saw this week. People before the quarantine was all tied up in the house, and every family member is focused on each of their social devices. And I will say iPad, phone, whatever it is you have. But now that you're in quarantine, everyone wants to be outside. This is not the time to be outside. This is the time to be playing with your devices. And this is why I think it is confusing to many people, because we call it social distancing, and that is where we want them to be 6 feet apart. But I think it's social distancing, and if you look it up on Google, you'll see social distancing or physical distancing. I think the word we should be using on a daily basis, not to confuse most people, is we call it physical distancing. Why we want to call it physical distance? Because we want to be physically distanced from someone, not really socially, because I'm connected to you guys right now. You connected to your family with FaceTime. We got a lot of people, businesses using Zoom and stuff like that, Skype, WhatsApp, whatever it is you use in your area. But the thing is, we're really more socially connected right now. We are really socially connected with these devices and technology. So to call it social distancing is a bit misleading. We want to have physical distancing, but we want to stay socially connected so that we know what's going around in the world, and so stay closer to family without actually having to physically be with them to infect them. So quick point on that. This is what the world map looks like right now. World COVID, these places in red like China, where is it? Iran, France, Spain, Great Britain, UK, the US, those places, Italy, all in red, over 10,000 cases. So this thing is worldwide. You have over 1,000 cases reported in a lot of places, Australia, Brazil, Chile, stuff like that, Canada. And again, this entire world is infected. This is why it is so important to close the borders, shut down travel, so that we don't infect other people. And when you do travel into a country, go on to a 14-day quarantine yourself, so that, again, we make sure that we are okay and make sure that people that we are visiting stay okay. Now, Britain is now on lockdown, and all essential non-businesses must be closed. So how long is it locked down for? For at least the next 3 weeks, they're saying. What remains open? Parks, supermarkets, food shops. Now, I'm telling you something interesting with the parks. In the parks, the US, in Maryland anyway, we just shut down parks and stuff like that because the people are not paying attention. We leave it open like they're doing now, or Britain is doing right now. And guess what happens? More than 10 people, 12 people, there's everyone going to the park to exercise and work out. They can't work out in their house or apartment, and I don't know why. But they seem to go to these parks, and then they overcrowd in the parks, and they're not paying attention to social distancing. Kids, teenagers get out there, and they want to play football, they want to play games, and they're all connected. So eventually, I'm going to predict, like I've been predicting for the last weeks, and everything has been 100% foolproof right now. When I said a couple days before the Olympics, what are they waiting on? They need to shut down that Olympics right now. 2 days ago, they announced that the Olympics is actually shut down. So now let's see. What remains open? Health shops, pharmacies, petrol stations, or we call it gas stations in the US, car rentals, pet stores, blah, blah, blah. Just to name a few, and then we could go to the next slide and we'll say ordered to close: restaurants, takeout services, bars, nightclubs, hair, beauty and nail salons, piercings and tattoo parlors, and to just name a few. And the list goes on what you can and cannot have open, because these are really unnecessary businesses to be open, because it actually brings you closer to people and interact with people, and that is a no-no right now. So here's a meme: fighting coronavirus. Eat 5 cloves of garlic every day. It does absolutely nothing. So don't believe that you need to eat garlic and it's going to prevent you from getting the virus. That is absolutely not true. But it does keep everyone else at a safe distance because, of course, garlic breath. So that was interesting. But just to give you the good, the bad, and again, like we said, the ugly, eating garlic is not going to prevent you from getting this virus. Now, this was very interesting. World's safest spots from an apocalyptic outbreak, coronavirus pandemic, etc. Scientists have worked out the safest spots to live if a sudden global pandemic threatens humanity. They ranked islands based on criteria such as the ability to avoid contagions and outside areas, because these places are easily locked down. You could close borders out easily, and they have the technology to do it, obviously. And it is one of the top 20 safest places to be on the planet. And I thought this this is very interesting, because I'm originally from number 8, Trinidad and Tobago. So again, that I thought was pretty cool. That island could shut itself down instantly if it wanted to. If the government was smart enough, it would shut it down. They won't be inviting in prime ministers and presidents from other countries right now. Everybody should be shut out. And this way it isolates the people in that country. So the number 1 is Australia, New Zealand, Iceland, Malta, Japan, Cape Verde, Bahamas, Trinidad and Tobago, Barbados. What caught my attention on this list? You have Jamaica, it's a lot of Caribbean islands on this list. So I'm telling you, Caribbean people should be very blessed right now to know that they're in a situation where Cuba, Mauritius, Fiji, the Maldives, you name all of these places, they're very easy to shut down and keep the people and population safe until you isolate and eradicate the virus. I have one more thing to say about this. That is going to be a huge task. Even if these people are safe, as long as we leave one person alive with this virus, or they have it, as soon as we open up and relax borders and we relax travel and we relax workplaces to go back to work, if one person has it, this virus, I am telling you right now, they are going to reinfect the entire population in that area. And as we know, you have 1, you have 10, you have 100 people, it is going to reinfect the entire world all over again. So this virus is going to be with us for a while, until or unless they get a vaccine. Now, when we talk about vaccines, a lot of people are anti-vaccine. They will never take a vaccine. But now you got to put your ego aside, and when they come up with a cure for this, you have to take that vaccine. Why would you have to get that vaccine? So that you do not go and spread this thing and reinfect people all over again. Anyway, moving right along, the coronavirus timeline. So day 1, this is what they say happens. Day 1, you get a fever, maybe fatigue, muscle, or a dry cough. And it's normally a dry cough, fever. That is what you're going to have. Day 2, difficulty breathing is going to start, and it's going to go with those symptoms all the way up to day 7. And if there's trouble with your breathing, then you're going to be admitted to the hospital at day 7. Now, day 8, acute respiratory distress, and that is when your lungs and stuff starts shutting down. They put you on all of these ventilators and stuff. Intensive care unit, you're going to be on there. Day 10, day 12, fever ends. Day 13, shortness of breath stops. This thing takes time. Day 18 and a half, death to those worst affected, cannot recover. And day 22, that's quite a while. This thing is going to hit you for 22 days. So this is, I don't know what you're going to do with shutting down things for 14 days. This is more like a 21 or 3-week shutdown. And then illness finishes, and I'm sure you're not going to be 100%. You're going to have to go home and then recover anyway. So I think this timeline is very important for you guys to get a grasp of. This is not something that's going to shut you down like a flu. This is going to shut you down if you get infected, possibly for at least 3 weeks. Now, moving right along. Numbers as of today, around 5 p.m. today, earlier today when I snapshot this, the United States had 97,000 confirmed cases, 11,386 cases confirmed today again, plus 11,000 cases in one day. So when you pick up nice and slow, and then boom, this thing hits you. So when these countries have 1 or 2 cases or 10 cases or 15 cases, and they think, oh, this is not too bad, then all of a sudden that 10 turns into 120. And then it's very, very bad news at that point in time. And that is a no good situation to be in. Now, let's look at the next chart. The next chart says global COVID-19 cases, 586,000 cases worldwide with 130,000. You don't hear about the recovery rate, but 130,000 recovered. So the difference there is still active or dead, right? So as you can see, the red chart going up is the confirmed cases. And again, that's confirmed because it did a test. How many of us are walking around that did not take a test and is infected? So you actually are walking virus and you're not infected. So you're not on this chart. You're not anywhere accounted for because you just haven't been tested. So places that are like New York testing 300, 400, 500 case tests a day. Some states, some countries have no tests, maybe 100 in a month. And then they say, oh, our numbers are low. No, your numbers are low because you haven't tested enough people to get the real numbers. So don't get fooled by numbers. Again, moving right along, the global United States, 97,000 cases. Number one now. It is the epicenter right now because we have the most confirmed cases with 1,476 deaths. But that's not too bad. It's bad, but not too bad compared to Italy. 86,000 cases, 10,000, almost 11,000 recovered, but they had 9,000 deaths so far. And I believe last night, this morning, when we woke up, Italy had 900 cases, new, confirmed. So that's not going anywhere in a good direction. China, 81,000 cases, 74,000 recovered, 3,000 plus deaths. And as you could go all the way down the UK, 14,743, recovered 151,76. Then you have Germany, France, you have Canada, you have all these other countries. And the list go on and on. You could move over to the second list. You'll see this is isolated to the US only now, not the global, but the New York is actually confirmed 44,000 cases with 519 deaths. So New York is doing not so good. It's very bad over there. New Jersey, which is technically right next to New York, is no wonder it's the second highest with 8,000 confirmed cases. California, and then you have Washington, that state, not DC. And then you have Florida, Michigan, then you have Louisiana, Illinois. Again, we go on, and you could see the numbers. It is just growing on a daily basis, and we have not hit the peak. And with that said, on a lighter note, let's get right into it. The WHO COVID Sutra guidelines. And again, this is just for fun. This is on the lighter side. As you can see here, this is from thefunnybeaver.com. And for all of you guys talking about social distancing, sometimes you're in a house locked up with people. So here's a way to spend some time. And at least you now know what is the correct way and what is the wrong thing to be doing now to maintain good health. That's funny. Don't take this seriously. But back onto our next serious note. I think this is very serious because a lot of people say, oh, waiting for the government bailout and the government bailout. Well, politicians are fighting over how much of your own money they should give you. I want to read that again for you guys because I looked for a meme to express that point today, and I think this was the closest one to it. Politicians fighting over how much of your own money they should give you And that is further proof they shouldn't be trusted with any of your money. Now, why do I say that? Because it's not the government bailing you out. It's not the government sending you checks. How did the government get checks in the first place? Is it because of your tax money? So it's the taxpayers. So all of you talking about taxpayers and the rich getting this, it's your tax money that they're taking now. And that's how the government got it. And now they're going to send you out a little measly, what, 1,200, 2,000, 4,000, for how long? How much is that going to help you pay your bills? They're collecting money from me for years. What are they going to give you back now? 1,200 bucks? Some people paying 20,000, 15,000, 40,000, $1 million in taxes every year. So don't get fooled that the government is giving you money. This is your money. This is the tax workers, payers' money. And if you're not paying taxes, well, this is a handout to the person next to you that's actually working and paying some taxes for you. So call that person and say, hey, thank you for the bailout. Not the government. And I don't care which government it is. This is not politics here with me. This is just a fact. Doesn't make a difference if it was Democrats or Republicans in office. When the government does this, this is to save their own ass, to get you appeased and to make sure that you have something. Because if you don't pay your rents, guess who's going next? It's the landlord. And who's going next? The banks. So it trickles. So this is to save them by giving you something to just keep you nice and easy going for the next week, the next month. And maybe next month they're going to have to send you or some of us or some of you a new and different check in order to appease that situation. So call someone that's paying taxes and say, hey guy, thank you for paying taxes. Now, let's close off on this. And this is just on the lighter side. I've noticed a lot of you are not posting selfies anymore since the beauty salons have closed. So that's the news and the update for this week, guys, so far. We hopefully in the next couple days, you'll give it a 3-4 days, get some more news and get some fun stuff, important stuff, but also facts that could help you and your situation with your family. And make sure social distancing involves stay at home. Do not visit grandma and grandpa. I know my mom and dad are isolated in a house together and no one is going to be visiting them. They're 80 years plus. So that is great. It is better that your grandparents are by themselves with no one visiting. They can order what they want at home. No one visits grandma and grandpa. You shouldn't be going from one house visiting aunts, uncles, nieces, nephews, cousins, coming together at this point in time because you're going to infect everyone. So let's close on that note, guys. Again, you like the video, hit like. Make sure you share the video so we get it out to every single person. Again, you guys have been doing a fantastic job sharing the other videos. I think we hit over 20, 30 homes in the last, with the last 2 videos alone. Make sure you share it so that everyone is aware of the information. Make sure you subscribe so you get a follow-up email when we put out the next video in a few days on the topic. And also, make sure to work less. I've been saying this for years and years. You guys need to work less. Play more and enjoy life. People always say, Barry, how it is you always have so much free? Because I work less. I learn to play more, and you have to enjoy life. No matter what is going on out there, you need to have a way to enjoy life, and you'll never be ever bored. All right, guys. You guys have a fantastic day. Have a fantastic week. Hope everyone stays safe, and I'll catch you guys next time. Bye-bye.